As the 16 days of activism marking this year's International Day Against Women Violence draw to a close, more Nigerians added their voices to the urgent need to protect the future of the girl child as mothers of tomorrow. One of them is a health expert and philanthropist, Dr. Amina Aminu Durai, who is currently the technical director sustaining health outcomes through the private sector, a project funded by the U.S. Agency for International Development, USAID.
Speaking exclusively with Clearview Television, Dr. Amina Dorayi called for total support for the recently launched Sex Offenders Register to help stem violence against women.
One of the main, should I say, issues that I'm really happy about is the launch of the Sex Offenders Register that also happened on the first day of this activism. I was also part of it, and the register is such that, anyone that is found or, that has, that is found as a, rapist, or even try to become violent against any, not only females really, because this gender-based violence is both males and females. That person's name and details will be in that register. I think it's time for us to name and shame people. It's time for us to come together as a community, as a country, that this is not acceptable. And I think as I was saying earlier, most of the uprisings and changes that have happened in this world have happened not by leaders, but by followers. Them saying that we will not accept, coming together, forgetting every differences that we have, to come together against this issue. Gender-based violence is one of the most demeaning things that can happen to anyone, young girls, boys, women, men. So we will not accept it again. And as a person, I really am happy that Nigeria is now part of the countries that are very much active against this main issue.
On growing cases of sex for marks in tertiary institutions, Dr. Dorai said, if the unacceptable practice of lecturers is not nipped in the bud, Nigeria's education system will soon become a laughingstock.
I was very upset about the whole issue. Why? Is because I come from the north, and in the north, education of the girl child is even a major issue. Why is it a major issue? Because our parents, and especially those in the rural areas, believe that Western education is not good enough, especially if, it spoils children and all that. So for us to even bring out this sex for marks, what do you think they will say? They will say, oh, that is why I didn't take my child to school. Or even if I take my child to school, this is the challenges that these girls will be facing, and you want us to take our children to school. So for me, every issue that comes up has a serious boomerang effect, and it means that how can we, I am a product of education, and I know I'm where I am today, yes, by God's grace, because of the education I attained, because I had a father that believed that both males and females have the right to enjoy the same type of education. I had a husband, very importantly, that also is quite supportive, very, very supportive of my work and everything I do. So I think that this Sex for Grades thing was, came out, first of all, I'm not happy that it also came out from BBC. Why aren't we within the country the ones, coming out to investigate this? This has been happening since before I went to university. So it is not something that just came out now. We all know about it, but we are all to blame because we did not bring it out to the fore. And most of the time, people are afraid. There's this thing about being, if you're at the position of power, those that are below you, like the students, or they will be afraid that if they come out and say it, they will be the ones that will be affected, either at their school or so.
Commenting on her motivation for engaging in philanthropy, Dr. Amina Dorai says her role as a medic brought her into contact with the needy in the society, and so decided to offer a helping hand.
The good thing is, because of my profession and because of the work I do, especially in public health, I have the opportunity to meet different kinds of people, both those that have privileges and those that are quite underprivileged. And it touches my heart because, you see, I feel that I am not better than anyone for me to be in a position to help people. So, and I know that this life is very short, and what you will gain, they say what you give out is yours. What you use yourself is just, you have just used it for yourself. So what motivates me is that, first of all, it gives me the happiness and the passion to say that I have also helped. Of course, as an individual, what you can do is minimum. But if if you come together with like minds, there's a lot you can do. Even for like your TV program, for instance, even trying to take the word out, trying to make people know what is happening, inform them, get people to also talk about what their views are on making changes. It's also one step, that will hopefully make our country better.
She also called for deliberate policy by government at all levels to improve the working conditions of medical doctors and other paramedical staff, to check brain drain and medical tourism. Florence Philip reporting for Clearview Television.